Good afternoon, everyone. Thank you for joining us today. We are excited for this conversation. The presentation is being recorded, so a copy of the recording along with the presentation will be sent to everyone as well. Just we'll go over some logistical items. If you do have any questions, you can feel free to add it to the Q&A section or the chat section. Um, Dr. Johnson is flexible as we're going through the presentation. If you want to ask a question, I will be monitoring that. But we'll also have time for after for Q&A as well. So I'm going to go ahead and get started. Thank you all so much for taking time out of your day. I've been doing free parent webinars for 5 years. When I first launched, I was doing 2 a month, and it excites me. We had over 50 registrations for this one, but that the interest is there as we continue to learn and grow, whether we're professionals, parents, caregivers, um, relatives of somebody who has a child who's neurodivergent or IDD, just helps with our knowledge and gaining access to our ability to support them. So I'm Tiffany Feingold. I am the co-founder and CEO of Guiding Bright Minds. And as I mentioned, I launched 5 years ago because of my own personal experience as a parent. And I have such a passion for parents because I know how isolated, alone, and overwhelmed that we feel. And so I wanted to create a community where we support each other. And the first thing that I did when I launched Guiding Bright Minds was create a directory of providers because I know how overwhelming it is to find providers. You get a diagnosis and you get a list of services and you go on Google and it's overwhelming. Well, we partner with amazing organizations like Tepiac and those that really care and embrace supporting all different kinds of services and needs for people. And so that's one of the exciting things that we do. So if you haven't not checked out our website, and I'll put some links in the chat, but visit guidingbrightminds.com. We have a neurodiversity directory, and I personally meet with all of the providers myself. We have hundreds and hundreds of different types of articles and blogs to help with various types of needs for parents. So take a look at that. And then we also have our events calendar. So, a list of all of the events. One of the things that I just recently started was a parents' night out event. So, you can come out and meet other parents. As I mentioned earlier, that is such a huge passion for mine. It's been life changing to be able to engage with other parents of neurodivergent children because they understand. You don't even have to say anything, you just feel embraced and loved in a different capacity than even my friends of neurotypical kids, which I don't even talk about, issues that come up or arise or questions that I have anymore because they just don't understand. So the Parents' Night Out is currently once a month, and it actually happens to be tonight. So if you are looking for ways through our free parent webinars, through our empowering parent programs, through our Parents' Night Out, we have ways to get connected and build community. So, like I said, I'll put some links out there for y'all to check out. But I'm excited for the topic today. So, today we're talking about transition to adult care for individuals with intellectual and developmental disabilities. And our special guest, so excited to have Dr. Emily Johnson, who's a physician with Tepiac Health Community Health Center. And Tepiac is one of the most inclusive healthcare providers in Denver, offering comprehensive care for all. And they focus on with love, empathy, and humility. And I love the program and how it's all encompassing under one umbrella. So, Dr. Johnson, thank you so much for taking time out of your busy day to be here with us. And if you could share more about you and the services you provide, that would be great.
Yeah, so let me just start sharing my screen. Okay. So, hi everyone. My name is Emily Johnson. As she said, I'm a family physician at Topayet Community Health Center. I'll talk a little bit more about the topic, but transition is really why I kind of got into family medicine. So this it's really difficult. I see a lot of people who struggle with this transition from the pediatric system to the adult system. And so when I was in medical school and training, I was really motivated to try to help with this and see people into adulthood. So I'm able to see people across the entire age spectrum, which can ease this process a little bit, but also have a lot of experience helping people navigate this process. So a little bit about my background. I'm from Colorado, originally grew up here. I went to the University of Colorado for medical school. After that, I always knew I wanted to work with individuals with all types of different disabilities and neurodivergence. And so I selected a family medicine residency where I knew I could get that training. And there's not a lot. I looked very hard and found one in Tacoma, Washington. So I trained and did my family medicine residency there, had many patients with different types of developmental disabilities. And my mentor there had a son with autism. And so got great experience there. After that, I spent 3 years in Colorado Springs at the Developmental Disabilities Health Center at Peak Vista Community Health Centers. I was fortunate enough after that to get an opportunity in Cincinnati, Ohio, and worked at the University of Cincinnati, where they have a developmental disability clinic there as well. Very robust, kind of multidisciplinary program there in a slightly different setting. But ultimately, for family reasons and a variety of others, we ended up back in Colorado. And so I started at Tapayak. And really, one of the main reasons or things that drew me there was really their commitment to providing good quality care for individuals with different types of intellectual and developmental disabilities. It's a hard thing to find, as I'm sure many of you have experienced, and Tiffany referenced in her introduction as well. But we do have some really robust services at Tapayak that I'll go over. So really just the first step is like a commitment to doing this well. Um, as you probably have experienced, it can be really hard to find providers that are experienced, competent, understanding, or even sometimes willing to care for people with different types of disabilities. And that really goes across the disability spectrum and different types. So TopIX been really intentional about trying to do this well from this lovely new clinic space that we have. It's about 3 years old, is accessible from a physical perspective, but also, and we continue to try to improve on this from a sensory perspective with the ability to dim lights, to do different things to help make it more accessible, welcoming, things like that. So some of the other ways that we do that is we have a variety of different services on site, and that's really helpful. The more, you can do in one place, you don't have to drive all over the place, the better. So we have medical, dental, and behavioral health all on site, as well as ultrasound if people need it. Um, in particular, one of the things that's really important to me as I've done this work pretty exclusively for a number of years is the extended appointment time, and that's offered to anyone who has IDD of any type. So instead of 20 minutes, all of our patients who need it get that 40-minute appointment. And you don't have to request it, it's just kind of standard practice um, for our population with different disabilities. For those that need help enrolling in Medicaid or other services, we have that support as well. We take really all insurances, I think, except for the VA, but all types of Medicaid, including Denver Health Medicaid, even though we're not technically a part of the Denver Health system. Same with Kaiser. So similarly, we're not a Kaiser clinic, but we do take Kaiser insurance. Um, Telehealth, obviously a great option. Sometimes we see people from all over, so we're not restricted by geographic area, any part of the state. So telehealth can be great if for those people that are traveling a little bit further. And then everyone in the clinic speaks Spanish as well, including myself. And so try again from a communication perspective to be very inclusive. If people need other interpretation services, those are also available. So a little bit more about my personal background then. So I got into this because I have family members with developmental disabilities myself. My older brother Eric and my son Noah both have Down syndrome. And so really just kind of experiencing a lot of this firsthand, a lot of navigating very complicated systems, both within the healthcare system and outside of it, is really how I got into this and why I care a lot about the primary care for people with IDD. For my brother, we have a lot of family conversations of like, what is adult? We're pretty past that like initial transition stage, but there's always ongoing conversations about transitions of care between parents and siblings, living situation, all sorts of things that are just ongoing conversations um, that I wish I felt like were not difficult for us to navigate either with my background knowledge, but it's hard for everyone. And then thinking about what that looks like for our son as he gets older as well. So I always like to start saying that like we're actually very fortunate to be able to have a conversation about transition to adulthood because historically that really wasn't the case. And so you know, in the past, many people with all sorts of IDD didn't live into adulthood. And so it creates this problem in that the adult system's not particularly well prepared for adults with IDD, and now we're even looking into aging adults with IDD, and this is all very new for the medical system on, the long scale. And so some of the clunkiness or difficulty of that transition is a product of our own success in that the medical system has done a very good job in better treating people with IDD in terms of their medical conditions, so they have the opportunity to live into adulthood. And so we're seeing people live into old age, which is wonderful. The systems just need to catch up a little bit to make it a little bit easier for everyone. As you probably have heard the term of falling off a cliff, this transition from the pediatric system to the adult system is described as an experience of falling off the cliff because of the warm support services of the pediatric health system, the school system, the pediatric therapies, the different organizations that serve children with different types of disabilities and neurodivergence. Many of them don't serve adults, and so all of a sudden, all at the same time, you're having to figure out what to do with all of this whole long list of things that you're used to, you're comfortable with, have worked well, and now all of a sudden it's different. But it's possible, right, to start building this bridge and to think about how we can make that transition a little bit less painful, a little bit less dramatic, and a little bit less scary. And so hopefully this will help kind of start to build this bridge and make it seem a little bit more doable. So there's three kind of main things that I want to talk about today. Many of these could be their own presentation, maybe their own series. They can be very complicated, but just kind of going over the main points, um, and to give you a sense of like what the process looks like and what things you want to be thinking about. So the three kind of main areas are just like the actual process of what does it look like to go from the pediatric health system to the adult health system. The second is thinking about skills, right? So as you become an adult, you have to do more and more yourself. And so, how can we equip people with neurodivergence or other types of disabilities to be prepared to handle increasing independence and do as much as possible on their own, maintain that autonomy as an adult? Um, and for anyone, even without any type of disability, that's a process, right? So these are all things that happen for everyone with differing levels of complexity. And then decision making. Again, this one is probably the one that could be like an entire series, maybe a college level course on decision making for adults with different types of disabilities. But we'll go over the very basics of that. So we'll start again with this process. Some of this is going to be like seem a little simple, but I think it's really helpful to think about the structure of the healthcare system as we think about what we need to do to transition it. So just thinking about healthcare, right? You have in general your primary care, which for most kids is a pediatrician, and they're kind of looking at the whole body. I'm in primary care. I consider it to be very important, though. I consider myself to be like the overseer of things, right? To make sure that everyone's on the same page. The cardiologist isn't doing something that the nephrologist doesn't want, et cetera. Like kind of getting that whole picture of somebody really knowing how it fits into their whole life. Um, So there's different types of primary care that are important to know about as you're transitioning. Some people don't actually know what type of doctor they're seeing, right? What their credentials are, how they were trained. And that's important to know whether or not you need to transition, when you need to transition, et cetera. So, like I said, many kids see a pediatrician and they're credentialed only to see kids. And so at some point, you have to leave the pediatrician because adults have adult health problems. Um, but some people might be um, those that have primary care who can see both. So, family medicine, myself as an example, right, we're credentialed to see children and adults. Some may have, in the adult side, there's internal medicine, they're only adults. There's also somebody called med peds. So some people may have a med peds physician. That's basically a combination of a pediatrician and internal medicine. They can also see kids and adults. Then you have all your specialists, right? So each body system, things like that. So we're also going to have to think about what specialists need to transition and when. And similarly, some are credentialed only to see kids, some only adults, and some across both. Specialists can get a little bit more tricky because, with kids who have pediatric onset chronic conditions, they might need a very specific specialist as they get older, somebody who knows something about that pediatric onset condition, which is different from maybe like a cardiac condition that you start to develop as an adult. And then dentist, this is always one of the most difficult, but really important to start thinking about and looking at different adult options. Um, I think one of the biggest things is the more desensitization for people that have a really hard time at the dentist you can do in the pediatric world, the better, because access to different types of sedation anesthesia can be very difficult in the adult world. So then outside of a type of doctor, there's a setting in which we get care. And so this is going to vary a lot person to person depending on health needs. But clinic, the people you go see, whether it's primary care specialists in a clinic setting, you go for an appointment and then you're done for the day. But then there's the hospital setting. And so anybody who's been hospitalized a few times, or anyone, really anyone, needs to think about at what point do you have to go from children's hospital to the adult hospital. Again, it's really important that although it feels very comfortable to go to the pediatric system, some people even want to go there into their 30s and beyond. Pediatricians don't have training and credentialing in adult health problems. And at some point, you develop adult health problems. So it is really important to make this transition and know when, why, and where you might go if you need that emergency level care. Then we have people's therapies, right? So this is also something that tends to have to transition. You might just be getting it in the school system. Some people get private therapies in school. And so this is important to think about in the transition to adulthood. I wish I could say this was easy. This one's one of the more difficult. Insurance starts to get pickier as adults, and so the justification for, in particular, chronic ongoing therapy can be difficult. It's also good to consider like Medicaid waiver services and other options for payment, what types of therapists you might see. But again, another thing that we just have to think about having to transition. Medical equipment. So anything you have ordered by a doctor of any type also has to make that transition from being ordered by the pediatric side to the adult side. And so usually that's taken over by primary care, but it depends a lot. And so I think this is just an area that many people forget needs to transition. What I've heard from many of my patients is they're like, "Oh, I just get sent this every month." Like they don't actually quite remember that it's something that's ordered by a doctor that they have to continue to sign off on because it ends up being an automatic process. But these are all things that physicians sign off on at least once a year, if not more. And so knowing kind of your list of supplies and what things need to be transitioned. Maybe your supply company only serves kids too. So this is an important thing that I think often gets forgotten about. So again, this is where the falling off the cliff comes, right? You are not only thinking about the health system, but you're thinking about the rest of life, right? What kinds of things you have going on the rest of your day, what activities, things like that. The school system, right, covers most of that until age 22, most commonly. Um, but we always have to start thinking about what it's going to look like. The school can provide varying supports on what this may look like, whether or not we're going to work or some type of day program, other activities, things like that. So, just to review, that was a lot of things, right? And so, this is just where, like, kind of wrapping our head around all of the things that need to make this transition as we're approaching this cliff, for lack of a better term. All of these things, primary care specialists, hospitals, therapies, the dentists, our medical equipment, school work activities, all have to go from kind of that pediatric system to the adult system. Um, and so, like I said, just kind of like this whole overall process. And I'll talk about some tips and strategies of how to make this a little bit easier. But the first step is kind of wrapping our head around what has to happen. So then comes the question of when do you start that process, right? That was a really long list of things. And so ideally this is something that starts actually quite early. People who are experts in transition recommend that this starts around age 12 to 14. Doesn't actually mean you're starting to actually do that transition where you're seeing a new doctor, doing new activities, things like that, but you're thinking about it, you're planning it. You maybe have a list, you're starting to talk to your pediatrician of like, hey, what age do I need to transition at? Um, yeah, when do I have to go see that adult doctor? Because it varies a whole lot. Some people, it's like age 18, they're like, yep, we're done. You got to go see the adult provider. So other places will say 25 is fine. Um, so just starting that, like, again, knowing ahead of time what age you need to have that completed at. When does it need to happen? And what is that going to look like? Maybe starting to ask for recommendations. Again, this hospital or ER question is also very important. It's like, where should I be going if I have an emergency? And asking primary care and them serving as a guide for this whole process is really important. They should be able to help with kind of that whole list of things, like what specialists, hopefully have some recommendations on adult primary care. When do you need to go to the adult hospital? For certain people that have like a specialist they're very tied to is very specific to their diagnosis. A specialist can sometimes serve as that guide. But again, I think of primary care as like the overseer, kind of the navigator, helping to make sure everything is on track. Um, but it's hard to start too early, I would say. So I like to start with primary care as the first thing to think about transitioning. Again, because they're kind of that overseer of things. An adult primary care is going to know a little bit more in general about the adult resources and adult system. So how do you find one? One, if you're close to us, you're interested in us, we certainly hope that many of you would be interested in coming to see us and helping navigate this process. Again, we kind of see all comers. We can see the whole family, really anyone. So we could certainly consider ourselves to be a good resource in that sense. But there's other ways you can ask around and find other options if that's not a good fit for you. So obviously, you're like your pediatrician, if they have recommendations or ideas, definitely a good place to ask. Friends, community, obviously the world of parents of kids with disabilities is very tight knit, and usually you can find good recommendations within that community. And then other organizations, churches, other things like that. There's lots of, using your community to find those resources, in particular for primary care, which can be very tough to find. And find primary care that has any sort of experience with people with disabilities can be tough. This is also something I think people are surprised about when they transition is there's unfortunately big differences between the experience of getting care in the pediatric system and the experience of getting care in the adult system. And it's something that we hope long run the system will improve and that it'll be more friendly for everyone. But right now, the adult system just is a little bit less kind and a little bit less welcoming, a little stricter on things. And so it's good just to have that expectation going into it that there are some things that are different. One, depending on where you go, the length of appointment time tends to be shorter for the adult world. And like I said, at our clinic, we're fortunate to have those longer appointments for people who need it or have that higher level of complexity. But in general, super short appointments on the adult side of things. In the pediatric system, there's a lot more resources to navigate the system, case managers, complex appointment scheduling where they try to coordinate everything on a single day as much as possible. A lot of that's just kind of part of the experience of, in particular, getting care at like a children's hospital or those pediatric specific systems. Once you get to the adult world, it's really more of an expectation that that's navigated independently. There's some support and resources, but notably less. and tend to be for kind of the most complex or the people with the highest need of navigating the system. In the pediatric world, there's often a lot of like specialized clinics that have multiple specialists, all people that kind of see somebody at the same time, do their kind of co-created plan. You know, the Down syndrome clinic, spina bifida clinic, Fragile X. You know, there's a whole list at Children's of like a really specialized clinics that maybe have specific specialists there, things like that. They all work together. That's much less common as well in the adult world, so sometimes we're having to, like, piece together things a little bit more, find a specialist here, a specialist there, things like that. Again, it's very doable, and, there's fortunately a pretty good network of physicians in the Denver area who are very interested in adult care for people with IDD, and so there's good options, it's just not quite as centralized. Then child life is another big one, that just doesn't exist. There's really minimal kind of sensory behavioral support in most spaces for blood draws, for procedures, things like that. Um, Again, it's not that it's impossible to kind of create, but something to think about maybe how you do that on your own or what things you need to bring to allow the experience to be a little bit better. And then late arrival policies. So most children's hospitals have very long late arrival policies, and we'll see somebody almost 30 minutes, sometimes more late. It's usually max 10 to 15 in the adult world. Again, right or wrong, it's just something to kind of know that this is a little bit of a different experience and to be prepared for. And so along those lines, you're also getting to a point where whoever's aging into the adult system has to start to do more and more on their own. And so as we think about how the adult system is structured, we have to think about what skills are needed to navigate that as independently as possible or as is appropriate for each individual. And that obviously varies, right, on what that looks like for every person. Number one is like knowing medical history. So in this transition process, it's very easy for things to get missed, for medications to get missed, for errors to occur. And that really occurs anytime you're switching doctors from, in particular, from a system to another system. Each health system has their own electronic health record, and that's not easily seen. It's not impossible to see it, but it's difficult to see it in different systems. So I can access a number of medical records, but it's just not quite as seamless as like our own, right? And so it's really important to have a good knowledge, whether it's parents and or individual, of what that medical history looks like to be able to communicate it to the receiving physician. Everyone will review the medical history to a degree, but also some people's medical record, if we still had paper records, it'd be like binders full, right? And so we also can't read 20 years of medical history, every single cold that somebody's ever gotten. We have to kind of do our best with kind of that summary overview. And so it's super important to kind of have a good baseline knowledge of what your medical history looks like to be sure to advocate for yourself, catch errors, things like that. Um, yes. Components of this tend to include, a list of diagnoses. That seems relatively straightforward, but important. Any surgeries that have been had, we have some patients obviously who have a whole long list, and there's some that are more relevant than others, but still really important because certainly in primary care, we're looking like, what are you at risk for going forward? What specialists might you need? All of that kind of stuff. Hospitalizations too. Again, similarly, I'm trying to think of like, all right, how do I prevent somebody from going to the hospital? So knowing why they were in the hospital before is really important for that process. Allergies, um, obviously important to know the allergies and the type of reaction that goes with it. What specialists you have. A list of specialists is super helpful. That way we all know like, all right, what do we need to get this person to? Who do they need to see? And then, like I said, medical equipment, one that I think is most often forgotten because it's just kind of part of the day to day. Um, I cannot emphasize medications enough. Even within a system, your medication list on an electronic health record is just often incorrect. There's a variety of different reasons. There's lots of hands in the pot. There's a whole lot of complex reasons why medication lists end up wrong, but they do. And so bringing an accurate, up-to-date list to literally every appointment, I cannot emphasize how important that is enough. So this is just kind of a basic example of something that, like, if people bring something like this to me, it's super helpful to get a good start on like what somebody's medical history is, like what I need to keep in mind. There's a variety of different resources on creating like a medical history summary sheet, things like that. There's a lot of different structures with varying levels of detail, and many of them are excellent. It doesn't have to look exactly like this, but this is just an example of things that are really helpful as you're making the transition process, really for any physician, primary care, or specialist. So you see here kind of different diagnoses, right? And even things like constipation, that's considered a medical diagnosis, can seem simple, but really important to know. Again, surgeries with dates, ideally. Allergies, again, with the type of reaction. The type of reaction is a really important component of any allergy. Obviously, we want to know, right, if it's that anaphylactic level reaction, what works for treatment, things like that. Again, don't need to completely beat a dead horse on the medications, but very, very important. And then specialists, right? Ideally with the name, the clinic, the telephone number, things like that, so that we can get in touch with anyone we need to. What therapies people are getting, medical equipment. This would include like incontinence supplies, gloves, chucks, things like that, all fit into the medical equipment side of things that somebody is ordering. And then communication. This is always one of my very first questions when I see a new patient is how do you communicate? And so very helpful to have kind of a list so that the doctors know how somebody communicates so that they're keeping that in mind. Also, I would say one of my pet peeves is when people have AAC to communicate and they don't bring it to the appointment. I understand people have varying levels of communication, but obviously we need to communicate directly with the patient in any way possible. And so if you have one, I just highly recommend that you bring it to all of your appointments. So even if it's a basic like, "Hi, hello, how are you?" You know, "What's your name?" Things like that. We really want to be communicating directly with our patients as much as possible. Yes, medications. Um, yeah, those were all the same things I already said. Okay, so in terms of independence, right? So a lot of these are adult skills that, like I said before, any person transitioning from the pediatric to adult system needs to start to develop these independent skills, whether they have a disability or not. It's part of becoming an adult. It does look different for every person. Everyone needs help in some way, and everyone should have help, especially navigating their healthcare. But the way that that help looks is going to vary a lot in the amount and the type of help that a person has. But each person, I think, regardless of that, can start to develop skills of how they can be more independent in navigating their systems and navigating their healthcare. One tool that I think is important to remember that exists is the IEP. So as you're getting maybe into high school, into that transition program, it's worth considering using your IEP or having a goal in the IEP of like navigating the healthcare system, knowing medications, or how do you schedule an appointment, different skills that can help with those um, adult healthcare system skills on how to navigate. A couple of other examples of what those skills may look like for each in person, as we said, knowing medical and surgical history. It's also something a pediatrician can really help with, right? Of like creating that summary or looking over one that you create. Um, Promoting each individual knowing what medications they take and why. This is something that honestly adults in general don't know very well. The number of times somebody comes in and is like, "Hey, it's that little blue pill or the little red pill," and I'm like, "I don't have any idea what pill that is." But knowing the name, why you take it, the dose that you take, when you take it, super great skills to have, and super helpful for any doctor. And then just like the how do you schedule an appointment, right? So this can vary a lot system to system. Fortunately, for some of our neurodivergent patients, we're having easier and easier ways to schedule appointments electronically, right? Sometimes that phone call is such a barrier. And so maybe it's just knowing on the electronic portal, like how can you schedule it that way? Or do you have to call? Um, who can you rely upon to help schedule the appointment? How are you going to get there? Kind of that stuff that seems really basic and in the back of your mind as a parent, but something that if we're going to really work on those independent skills is really important. Answering questions. This is a great thing to practice with the pediatrician. And they usually do a good job at this. Once you get to be a teenager, they're starting to ask questions more and more directly to the patient or the individual rather than their parents. But as a parent, the hard part is letting them do it and giving them the time and the space. And so it's important to be intentional about allowing them to answer more and more questions in whatever their communication method is, to be able to communicate their symptoms, their needs, things like that more and more on their own. And again, for some people, it's just a greeting, right? But having whatever communication that is and whatever that looks like for you is great to promote those skills. How to access your medical information. We'll talk a little bit more about this and what it looks like to transition that from a parent to the patient themselves or your child. This will happen automatically, so it's a good thing to plan for. If you're used to messaging all the doctors on the portal yourself, at some point they're not going to let you anymore, and that some point is age 18 on the dot. And so having a plan for what this looks like, which again in the next section we'll talk about a little bit more in depth. Picking up prescriptions, even knowing just like what pharmacy is it at? How often do I need to get refills? For those that are more independent, maybe it's recognizing, hey, I only have 3 pills left. It's time to call and get a refill. When do you have to call the doctor for a refill instead of just the pharmacy? All these things are, I think, things that just become second nature, but are really good skills that we can start to promote as people get into their teenage years and beyond. There are a variety of tools. So like I said, this is a lot of information, and I'll send some of these tools to Tiffany to share with their recording and other resources. But Got Transition is a great one. They have some kind of preparation checklist, and these checklists exist for patients, for their family members and parents, and for healthcare providers. There's slightly different versions of it, but they're kind of like readiness checklists, and again, provide a little bit more information on the skills that might be helpful to develop, thinking about which ones are appropriate to work on depending on the support level need and things like that. But you can see, you kind of can look at like whether or not you can do it, something you want to learn, or something you already know very well, and has a whole list of like knowing allergies, family medical history, seeing the doctor on their own, how to get emergency care. There's even more than what's on just this list, but it can be a good reference, understanding that you're probably not going to have memorized everything I just said, and there's a variety more that could be really good to work on. Um, so I mentioned briefly, but communication is a big piece of this. So communication's a big goal for a lot of people with different disabilities and neurodivergence of like what is the correct method of communication. And so even people come to me as adults and we start to look at or think about if there's new or different ways that somebody might be able to communicate. But I encourage everyone to try to have something, or kind of be able to articulate what their method of communication is if it's not verbal speech. So if it's sign language, a device, nodding, winking, no, blinking, sorry, things like that. Most people have something, and so kind of articulating that or thinking about ways that maybe it's time to look at other options, or expanding speech therapy in ways that could help people develop new styles of communication. Right. So the last portion is decision making. And this, as a disclaimer, I'm not a legal expert, but I help people navigate this decision making process a lot. And so I know a good chunk of what it is. And so these are just considerations of thinking about what form of decision making, supported decision making, things like that is appropriate, depending on the individual. So at the basics, legally, when you turn 18, the right to make your own medical decisions, manage your own health information, automatically goes from the parent to the individual. And this is regardless of your ability, regardless of your medical history, how much your parents been doing for you up until that point. The day you turn 18, if you don't make decisions and plans otherwise, that goes from the parent to the individual. That includes my chart access, paying bills, navigating the system, making appointments, getting information. And so it's just good to know that that change is going to happen. And ideally, you plan ahead of time. I will say It's not as urgent as people make it sound. There's ways to keep doing it as you become an adult, but it's just good to know that this is going to happen. So there's a variety of options of how we can go about navigating that switch from the legal perspective. And they go from very little restriction to the most restrictive or most supportive options for people. So when we start at the end of the spectrum, that's kind of the simplest, um, is like a release of information, right? So this would just be at an appointment, signing a piece of paper as the patient that says, yes, you may discuss my medical information. You may discuss all of this with my parents, with my friend, whoever, right? You can do a release of information for anyone. And this allows, right, the clinic, the hospital, whoever, to have those medical conversations with the doctors, the staff, things like that. Um, and so this is like the simplest, easiest way just to make sure you continue to have that access, that if you call somewhere, they're not gonna not give you information, things like that. This is also the most limited, right? It's just access to information. Doesn't allow you to actually make the decision or sign consents. It's just kind of the information access. And this, I will add a caveat, this does not apply to patient portals typically. So usually that access and control of the patient portal information still gets transferred to the individual. Supported decision making is kind of another option. So there's increasing legal frameworks for this in which a person outlines who they want them, who they want to help them make medical decisions. Um, I don't have all the exact details on Colorado law around this, but this is a state specific law issue of like how much legal backing this type of framework has. But the idea is that everyone needs help making decisions and they can decide who they want to help them make those decisions. Like maybe mom is the one that helps them with healthcare decisions, brother helps them with financial decisions, or things like that. They get to create what that looks like and have people that help them make those decisions. It's outlined in a document. Medical power of attorney is another good option. Um, it's and this basically gives decision making, medical decision making power to somebody else in the event that somebody cannot make their own medical decisions. That last portion is relatively important in that it's in the case that the individual cannot make their own medical decisions, which sometimes is much of the time. Sometimes it's only like, I have a medical power of attorney, but that wouldn't go into effect unless I was severely injured in an accident or things like that. So most recommend that actually everyone have a medical power of attorney, somebody that's going to make your decisions that you want if something were to happen and you couldn't make them for yourself. Where it gets a little complicated for people with disabilities is, when is that point of them not being able to make the healthcare decisions themselves? And when does the power of attorney come into effect? Um, the other thing is you do have to be able to understand what you're signing when you're signing a power of attorney. So somebody needs to be able to have a concept of like, I am giving decision making ability to my parent if I'm not able to, type of thing. If they don't understand that process, this really doesn't hold a whole lot of legal water from a medical decision making standpoint. And then the last is guardianship. This is by far the most restrictive. There's a lot of controversy around who, when, if anyone should have guardianship. It's still very much a part of our system, so it's a good option to know about the pros, cons, and alternatives to guardianship. But basically, this gives all decision-making capability. You have to go through the court for an individual. It essentially is more or less like still being the parent of a child. You get all of the decision-making power, and you're replacing taking all of that decision-making power from the individual. As I mentioned, I think it's important to think about this as something that everyone needs. Um, most people rely upon family, friends, a variety of different support networks to make big medical decisions or to make small medical decisions. And so it's not something that's different. We just have to think about how we're going to do it for each individual. There's a variety of different frameworks out there on how to think about what type of support people need in making decisions. And we all, right, have this kind of what we call circle of support. I think, the name circle of support and the specific model is very much applied toward people with disabilities, but this is something that applies to all of us and something we should all think about. So if you think about yourself or your loved one at the center of the circle, They have varying levels of support in their life, family and friends being some of the most obvious or closest in, but neighbors, support groups, organizations, institutions, and healthcare professionals are all a part of that, and they can all be play a role in different ways in that decision-making process. The other thing is just practice. So sometimes it's not that somebody can't make their own decisions in any given situation, but that maybe they just need to practice it, start thinking about it, having conversations. And again, the earlier you start kind of thinking about what that looks like for an individual, the more prepared you'll be of what framework you'll have in place as they get older. So, to kind of review all of that information, some of the big take home points I would say is one, start thinking about it early. I don't know exactly how old your loved ones are, but feel free as well to pass this on to the to people who have kids who are 12 to 14, right? Because you can't really start too early. At the same time, no need to panic if you're already at 17, 18, or even older, right? 20s, things like that. This is all a process. It happens across the lifespan. There's always something that we're thinking about for care, decision making, things like that that transform as we get older. Then know your transition plan. So this is as simple as just asking your doctors, when do I need to transition? And ask all of them. And just know so you know when you have to do it. Um, Same with the hospital. Ask the people in the hospital, primary care, when do I need to start going to that adult hospital? Practice these skills. So practice the skills, any of those skills in navigating the healthcare system. Rely upon other services, supports, the IEP, things like that to navigate that. Making that healthcare summary, knowing your history well. Again, pediatricians can help look over things. Um, all of that, they can help make stuff. But just having that kind of short, brief summary to at least give those adult doctors a good head start on what they need to do to take good care of you. And then plan for that decision making process. I said very, very brief overview of what that looks like. Again, could be a whole nother presentation, ideally from with lawyers, things like that, all involved on what that looks like. But start talking, asking other people what they've done, what worked well, what might be the right fit for you and your family. I have a couple additional resources, and I'll make sure to send these over to Tiffany as well. But as I mentioned, there's a whole guide on transition on gottransition.org that has checklists, it has different guides, resources, because realistically, you just won't remember every single detail from this. And there's other things that get a little more in depth on what it looks like to transition from the pediatric system to the adult system. Um, and then this is also one that's related to GOT transition, but the Center for Transition to Adult Healthcare for Youth with Disabilities has some more kind of specific resources for individuals with different types of disabilities in making that transition. Very similar types of checklists and different resources, but another great resource to take a look at. For our different future planning resources, the ARC has some excellent ones, and this tends to be the national ARC, but they have a lot. So they have this kind of decision-making resource that has different guides um, and future planning resources. There's also some financial planning ones, as that is definitely not my expertise, didn't get into it much, but financial planning is another big component of this transition and another legal component of it. And so they have some great resources on what that can look like, what saving looks like, how it impacts benefits, things like that. This is another kind of just further example of what supports they handouts, documents they have that you can download about kind of the different types of decision making, myths and truths about guardianship, um, and what that process looks like. So, any questions?
Thank you so much. A lot of amazing information. We will open it up for questions. Remember, you can put it in the Q&A section or in the chat as well. From I'm thinking because my son's 12 and I think about my difficulty as an adult sometimes when I'm seeking to find um, you know, physicians to partner with from the physician lens. What are some red flags parents or adults should look for? Or and on the reverse side, like what ways or questions can be asked to see if this is a good fit for the physician? Because every aspect of our lives, from schools and teachers and I mean, like, has to be calculated and intentional. So,
Yeah.
from your lens, what would be a good perspective that we should look for?
Yes. So I think one, there's just not enough physicians that at this point that are well trained in all the intricacies of life with a disability and what that looks like. So it's not necessarily that they need to know everything and anything about any sort of diagnosis or disability. The first step is honestly like interest, willingness, and them being willing to ask questions. I ask questions about my patients' lives and care all the time. That's like, all right, tell me more about this diagnosis, or how do you transfer? How do you do X, Y, or Z? And so, physicians that are willing to ask those questions and make sure they're learning from you about your experience is a great thing to look for because none of us know everything. And so, it shows that kind of like curiosity and again willingness to improve their own care and the way that they go about things. The other things that I think are good to ask is about any of those kind of accommodations that you can have in the clinic that you might need. And so, unfortunately, there's still a lot of places that are going to be resistant to providing extra time or that maybe if you use different medical equipment like a wheelchair, they might not have a scale that accommodates your wheelchair. And so anything that you need from an accommodations perspective, it's good to know ahead of time if that's something that's doable, or again, if they're even willing to consider like figuring out how to make it work. But again, that option for extra time I think is really helpful because as we develop those communication skills and ideally transition as much of that as possible to the individual, again, depending on their level of need, um, that time is critical because you have to practice it. Sometimes the responses takes a little bit longer, or you have to ask questions in different ways, um, and so that's super helpful. There's also just some practical things that are just part of reality, right? So if you primary care in the ideal world is close to where you live, um, that has to be balanced with a primary care doctor that's a good fit for you. So it can be like a little bit of a tug and pull of which of those is more important. Close to you is really important though, because if you get sick or you need something urgently, that primary care is usually that first point of contact. And so ideally, you're not traveling like an hour, right, to get to your primary care for an ear infection or a UTI or, whatever you need. That said, if you really need somebody or fit better with somebody with that specialized training or skill, um, sometimes it's worth having that distance. And so if you're traveling longer, you can ask things like, what are my telehealth options? Are there restrictions on that? How much can you do on the portal? So thinking about, how it looks on the day to day, I think is really important. And then, it's okay to go see a doctor and decide that it's not the right fit. It happens all the time. It's kind of like psychologists or therapists, right? You have to find somebody that feels good. So if you go to your first appointment to establish care and you're like, this just isn't a good fit for me, it's okay to go somewhere else. It's okay to change and to have that be a process.
Thank you, and that's the thing, and that's why one of the passions when I think about Guiding Bright Minds is creating that community of sharing, because experience is so important, and we know so it's crucial in the success of what that looks like. So I love that because, building the right relationship, and sometimes I know we're hesitant because we know how hard transitions are, which we're talking about, but to find
Yes.
a doctor is also so key. I do have a couple questions that came in.
Yeah.
One person commented, I really like the idea of participating in their IEP and in helping them explain their problems to the physician early on. I think that was spot on too. It's also a matter of trusting their physicians. What
Yes.
are ways the physicians can adapt to their environment to make it more comfortable for the neurodiverse individuals to feel comfortable sharing personal internal experience and discomforts, like things that they have at their medical offices environment.
Yeah. So there's what is and like what the ideal world looks like. I would say right now in the adult space, there's very little of like creating that safer, more comforting environment. Then there's a number of people kind of nationwide trying to work on making this better overall. I think one is, again, just like being aware of the different communication styles. And so that time what comes in again of like sometimes it's just having that extra time to allow for pauses and be like, all right, it takes a little while to answer, or again, asking how somebody communicates. The other thing I notice is, and this is true from like wrapping my head around somebody's medical history and getting that like relationship to feel more comfortable, is it takes a few appointments usually. And so there's always like that first appointment where you're like just trying to like get the list, trying to understand how things look. Um, but it usually takes a few appointments before, you know, that relationship is built, right? And so there is a little bit of element of like patience, getting to know somebody, again, allowing for that time for them to answer questions in whatever way they prefer. Um, like I said, some of the other adaptations, like we have the lighting piece of it, but we're hoping to get some like fidgets, different sensory things that people can have access to during their appointments. In the long term, our goal is to have like options for desensitization, in particular for dental, blood draws, ultrasounds, as much as we can do in our own clinic space. We're seeing that pop up in more and more clinics around the country, but it's a slow process. And so, kind of that like almost child life element, but the adult version of it. There's always this balance between like a welcoming, friendly space that feels warm and feels comfortable, and like not being infantilizing. And so, we don't have Disney characters on the wall, right, in the adult space, but you can still have bright colors, you can have appropriate lighting, things to fidget with, stuff like that. That honestly benefits all of our patients. Um, but yeah, the adult system has a little ways to go, I would say.
Yeah, there's another good thing when you brought up, especially shots and
Yes.
desensitization,
Mhm.
it's like a couple week buildup for my son when I think about the flu shot, getting that, it's going in, the
Yes.
doctor's understanding, and it takes time, but now he's in the
Yep.
pediatrician, so how to accommodate an opportunity for even, like, a sensory space for that adult, and when they're ready to get the shot, it might be an hour, it might be 2 hours later,
Yep.
but
Mhm.
they need that time to build up
Yes.
the courage to do it. What is an equivalent of a developmental pediatrician for an adult with an IDD?
Yeah, so one thing I forgot to mention about specialists is sometimes there's an equivalent specialist in the adult space and sometimes there's not. Unfortunately, largely there's not a developmental behavioral pediatrician in the adult world. So it takes a little bit of conversation with usually the PCP of what that looks like. So for me, oftentimes I just take over whatever the developmental behavioral pediatrician was doing. It depends on what the need was. For example, a lot of developmental behavioral pediatricians function somewhat like a psychiatrist in the adult space. So sometimes it's a psychiatry referral. Um, it depends. It depends. A lot of times it's taken over by the PCP, and sometimes it's psychiatry. In Denver, I think there's one specialist, Dr. Sanders, who is a neurodevelopmental disability specialist, and that's somewhat of an equivalent. But again, not exactly. So it really depends on the specific things the developmental behavioral pediatrician was doing. Um, some other examples of specialists that end up being different, thyroid. Many kids who have thyroid issues will see an endocrinologist in the pediatric world. That almost always goes to the PCP in the adult world. Same with diabetes. Adult primary care are well versed in type 2 diabetes, not type 1. Type 1 still goes to endocrinology. But it varies a little bit. Like sometimes you don't need the adult specialist and it's very appropriate for a PCP. Sometimes you transition. So it looks a lot of different ways. And developmental behavioral is probably one of the best examples. So it's really just having that conversation and saying, like, these are the needs, this is what they're doing. What does that look like in the adult world?
Awesome. I know we're getting to the top of the hour. There is one more question that I saw.
Yeah,
Does yet take TRICARE as insurance?
I'll have to double check on that. I know we don't do the VA. But let me ask and I will send that information to Tiffany.
Okay,
Yeah.
awesome. AJ, I will write that down and I will circle back with you on that question of TRICARE. Thank you for asking. Well, Dr. Johnson, thank you so much for your time. And I encourage anyone to if you have an opportunity to go check out Tepeyac and their facility. It's all encompassing, which I think is great. You are on the other
Yes.
side of the world from me, unfortunately, because I
Yeah,
went to it. I was like, it is amazing. But thank you, because I think it's these conversations as we see growth and knowledge, especially from the physician lens of just growing in their understanding of IDDs and neurodivergence, which is amazing to see. Because I think there's also that preconception that you've had tons of training on what neurodivergence is, and the reality is medical school doesn't cover all of those aspects. It
no.
has with learning and experience and growth. And I think, from a parent's lens, be prepared with the questions. We'll provide those checklists, but also, get your own checklist of what you're looking for, what the expectations. If a doctor's like office says, you know what, we're not going to allow extra time, move on to the next one. There are going to be more that are going to be adaptive to our needs and what that looks like, and building that collaborative community. So again, thank you so much. Thank you everyone for
Anytime.
joining today. I appreciate everyone's time, and I hope you all have a great rest of your week. Thanks, Dr. Johnson. Bye,
Thank you.
everyone.
Bye.